So again, I want to thank you for doing this.
I'm glad to.
And I've been enjoying our time, and the mentoring is wonderful. So thanks for letting me be part of that. I really appreciate it.
It's been my pleasure to do so.
Great. So I've noticed that you've done the shaking. I've seen you do the TRE and get the neurogenic tremor.
Right.
What is that like for you when you shake? Why do you do it?
Well, I started this years ago when I first met David, probably 10 years ago, and got his early CDs and followed them and got into the shaking and did it pretty regularly for a period of time.
Okay.
I do it now basically to relieve tension in some of the muscles, to release some of the tightness of the iliopsoas that pulls your back forward and gives you backache, because I have some backache.
Does it help your backache?
Yeah, it does.
Okay.
So you go into a different state, emotional state. There's no pain to it. It actually feels like kind of good, like this is something that really needs to be happening.
There's an awareness that it's right for you.
Oh yeah, this is something that really should be done.
Yeah.
Because it does make one feel at peace and at ease. There is a emotional content of calmness and satisfaction, even though your body is shaking, and sometimes fairly dramatically. There's a feeling of peace during it that's quite significant.
And do you know, because when I shake, I notice my brain works better. When I sit up, I feel sharper in a way.
And that makes sense, because what you're doing is extinguishing some of the muscle memory, procedural memory for that, whatever that muscle did to protect you at some point. And any emotional situation, the iliopsoas and related muscles tend to tighten to protect you.
But it has more impact than just tightening in your body, right?
Oh yeah.
Because if I tighten my psoas, if I tighten into my diaphragm, my breathing changes. I have a whole slew of chemical changes that happen in my body too.
Well, that's right. That's right. And we do. And when we carry that tension in those muscles as memories that haven't been resolved, it affects our autonomic nervous system. It affects our clarity of thought, because it inhibits the thought part of the brain, the frontal cortices, to a certain extent. Stress and that phenomenon of the muscles holding tension is very hard on one's thinking process. It gets in the way.
What about the saying that stressed out people do things that they wouldn't normally do? People under stress do things they wouldn't normally do.
Well, their judgment is narrowed. It's like the field of awareness is shrunk.
Yes.
And so you have a picture of the world that is limited by the fact that there are conflicts within that perceptual area. And so you're not as sharp as you are. You probably have more attention deficit.
More aggression?
More aggression.
Because we see it in the military, people coming back.
Yeah.
Domestic violence cases.
Oh yeah.
You know, working in therapy and seeing people this way. The more stress, the more crazy behavior generally comes out.
Well, those muscles that tend to be tight do so. That's why back pain is so common in returning vets. From the cumulative stress and trauma of the experience, and they tend to get tighter and tighter and tighter, and it takes less ambient stress to set them off.
So they're hair triggered.
The muscles are hair triggered.
So, yeah, so they inherit a habit. They create a habit of being in a certain shape, you know, whether I'm living in fear in a relationship,
Right.
or I'm in a dangerous situation where I have to fight,
Right.
and I pattern this. And then I let it go, I think.
Yeah.
But I'm actually hair triggered at that point.
You're hair triggered. And you know, it's interesting. Somebody talked about the attack position.
Yes.
That this was a posture which prejudiced one to get back pain. And of course, it is a posture with the back flexed, the arms flexed, the shoulders inward, when you're firing the rifle or preparing to shoot. And that posture gets stuck in your brain.
Yeah.
And any stress will produce that posture. And the posture, of course, involves the tightening of the muscles around the low back, very dramatically so.
And you'll see David Balsley talk about that when we get in stress, we contract in.
Right.
And it's inherent. I mean,
Yep.
nobody taught us to do this.
No.
It's ingrained. I mean, you know that because under danger, nobody goes, ooh, danger, and they open up their body, right?
Yeah.
They go danger, and they always contract in.
Well, these muscles are designed to physically help protect you.
Yeah.
and they're designed to be muscles that are used when you're threatened.
And these are the muscles that we're talking about that shake
Right.
in the neurogenic tremor.
Right. And so those are the likely muscles to hurt in anybody.
Yeah.
In other words, myofascial muscle pain is most prominent in that particular group of muscles of the spine, the pelvis, and the legs.
So you don't have to be living in a dangerous situation or being in combat.
No. No, you're going into that posture a lot. And you see people with this posture, with the shoulders up, around, forward, which is an emblem of them having assumed this position so many times that they're all there all the time.
They repeat it so often, they just say, this is who I am.
Yeah.
My shoulders are up, I don't know what you're talking about.
Right.
Right?
Yeah.
This is just me.
Yeah.
Right? As opposed to dropping and opening.
Right.
Great. So David Berselli talked about being in a building with a bunch of people sitting on a bench.
Yeah.
And it was being bombed.
Mm-hmm.
And male, female, Russian, Jewish, Christian, Catholic, didn't matter what gender, what race, where they came from. Everybody crunched in at the sound of the bomb and covered up their head.
Right.
Is that what you're talking about?
Yes, and that's called the startle response.
And that's a procedural memory.
It is. It's hardwired when you're born.
All right, so that when we practice TRE, we go through the 6 exercises and we start to shake.
All right.
What are we doing to this?
We are fatiguing all the muscles that oppose those muscles that protect us, so that those muscles that are tight can now go into a relaxed pattern, and they do so by shaking, by trembling. That's what happens after an animal has frozen, and it's still based on the freeze response. When the animal will go through a pattern of body movements that reflect exactly what they did before they froze.
Got it. Thank you.
Yes, they are replicating the act of escape. Otherwise, those procedural memories for what their body tried to do would be stored, and they would then begin to have problems with those muscles specifically, not necessarily the startle response, but the muscles that try to effect the flight and fight response. And
So this action that's stored,
Yeah.
incompleted action that's stored, is the basis for the statement that trauma is an aberration of memory.
Right.
So if I'm in the moment at 53, something goes off and I startle,
Yeah.
I'm actually going into a younger place
Yeah.
of an older injury or an older wound.
Often you will, and there may be nuances to that because there will be other muscles that try to protect you. For instance, if you were running and then you collapsed in a freeze response, when you come out of that, your legs would go into this running pattern, like a bird who flies into the deck, falls to the deck, flies into a window, falls to the deck, and then they shake all over with their wings flapping, because they are replicating the failed act of escape by flying away.
Okay.
And that erases the procedural memories. And TRE works by erasing procedural memories for this group of muscles that involves the startle response.
So we see a lot of different shaking. We see legs, arms, torsos, and those are at some level replicating something.
Yeah.
And we're extinguishing that behavior and allowing a more neutral response to everyday stress.
Yeah. You've probably seen this in TRE, but sometimes those muscles that everybody, mainly the muscles of the hip and legs that go through the twitching, it'll go up, climb up to the body, and then it may go into one leg or arm. It may go into an old pattern of old trauma, other than the one that we're talking about with the startle response. It releases the muscles that carry the trauma. The brain carries the message, but those muscles that are involved in self-protection have no opponents, and they can shake if you let them do so. And the technique basically inhibits those muscles that prevent you from doing it, and then the shaking is released. It doesn't make you shake. That tension is there all the time. This allows you, the brain, to take over and let those muscles do what they need to do.
Great. So you've mentioned a couple times procedural memory.
Yeah.
What do you mean by that, specifically with relationship to TRE and stress?
Well, procedural memory, the term procedure implies doing something. It implies a skill. And that's how we learn a motor skill. is through procedural memory. Any sport, any musical endeavor, anything where you use your body in skillful fashion requires repetition in order to incorporate the movement patterns that are acquired in your unconscious brain. And it's through conditioning. Because when you hit it right when you're playing the piano, you get a reward.
Yep.
And when you hit a home run when you're playing baseball, you get a reward. And so those muscles become very intimately involved in your practice of things throughout your life. Now, they also involve the muscles that you use to protect yourself, to attack if you're a predator, and to flee if you're a prey animal, and to alert and orient and do all the things one needs to survive. So procedural memory is unconscious motor memory. It's not memory in the muscle, it's the brain's memory for the pattern of movements of the muscles that one learns to protect himself.
So you said learned.
Yes.
Do I learn to protect myself, or is that instinctive?
It's instinctual, and that's why it's procedural. It's not conscious.
So you're speaking procedural memory versus conscious memory?
Yes.
Okay.
The conscious memory we also call declarative memory, words and facts and things like that. Yeah, things we memorize. And life events that we never forget. Because it is extinction of procedural memory. That's what he's doing. He's doing the same thing as somatic experiencing.
Okay.
But he's found the core muscles that everybody has tightness in.
Right.
So that, everybody has these muscles tight, and because of our culture, everybody has some trauma, and those muscles are tight in people who have trauma.
So generally, you think TRE would be applicable across the population?
Across the world, to any culture, any population. These are all instinctual muscles of the startle, and it's the same in every culture.
So it doesn't matter where you are, who you are, you've got some stress.
Yeah.
And TREs will probably be of some benefit.
Absolutely, yeah.
Great.
It did.
Well, I really appreciate this.
Yeah, you're most welcome.
Thank you very much.